Welcome to the Extraordinary Health Podcast from All Seasons Integrative Health with your host, Dr. Paul Bekkum. We're here to find the root cause of your health condition and help you to finally feel good again. At All Seasons Integrative Health, we utilize full-body chiropractic care and the latest cutting-edge physical medicine therapies, as well as functional medicine to help you live your full potential.
Hello, everyone. I am Dr. Victoria Lau, and with me is Dr. Paul Bekkum. So today we come to you talking about chronic back pain and the use of our focused shockwave to help with that.
Yep.
So focused shockwave. Well, the one thing I can say about it is I really enjoy the therapy. It has been most beneficial in even my chronic back pain. But yeah, let's talk a little bit about what it is exactly, and then we could talk about more on what it will do for a patient.
Okay, I'll give you a little bit of background here on focused shockwave. The focused shockwave is actually, it's an electrohydraulic form of shockwave therapy. It is something that literally, it's producing a spark. It is based off of lithotripsy that they used to use and still use to help break up kidney stones and gallstones to help a person pass those. But what they've done is they've tuned it for more musculoskeletal tissue. So technically it can be called orthotripsy as well. And what it does is it helps to break up some of the scar tissue that a person has going on. So it's especially good for just chronic joint problems that maybe have some arthritis going on, maybe have some myofascial adhesions, trigger points. It's just very good at breaking that stuff up, decreasing pain, decreasing inflammation, and it also helps stimulate the body's stem cells as far as connective tissue goes. So shockwave is awesome, especially for things like chronic back pain, because you can get in really deep. The electrohydraulic version of the focused shockwave will penetrate 4 to 6 inches deep in that range. So we can get down even into some of the inflammation that might be going on around a disc, especially in the lower back or even in the neck. So.
Oh, yes. It is a very hot commodity at the office. It is used in other therapies, of course, not only back pain. It's one of our strong protocols in our neuropathy protocol overall. But let's talk pain. So how does that help in reducing pain?
Well, it's more that, from the electric stim itself, usually that's also really, when you look at any kind of electric stim, it's actually kind of irritating the nerves in the area. So it's causing the nerves to release natural painkillers, your endorphins and enkephalins to help give pain relief to the area there. But it's also helping to stimulate blood flow to help get rid of the inflammation. So, the pain inflammation aspect, especially, when you're having chronic, spinal problems there, it works awesome for hips and knees as well as shoulders and all that as well. But it'll help reduce that. And most people are going to have about at least a 50% pain reduction the first time they have the therapy done. I know myself, I've experienced about 80 to 90% pain reduction when I've had some kind of acute flare-ups of things or acute injuries. It works really, really well. I still might have to run it for a period of time. I had a little bit more of a chronic tennis elbow going on from literally doing some landscaping around my house. And it took me about 11 times to really get it completely knocked out of my elbow, what was going on, but I really have had no issues with it ever since. So
that's awesome. As far as treatment goes, do we have a specific protocol for chronic back pain? I know we always talk mild, moderate, severe, extreme. Mm-hmm. So if a patient were to come in, how would we say, this is how long you'll have to utilize this modality?
Yeah, I mean, it really depends on the severity of what a person has kind of going on. I mean, if they've had like an acute flare up of something, so really it's going to depend on, their evaluation. And then we can give people a pretty clear picture of what it's really going to take uh, to help get them treated with the shock wave. If the shock wave is just going to do it by itself, if we maybe need to use, like our laser therapy with it, or maybe if they need some chiropractic treatment or physical therapy, whatever, we're going to get you assessed just to kind of find out what's going to give you the best results here to get your condition kind of calmed down. Getting into that, on the mild end of the spectrum, I mean, minimal, let's go all the way down to minimal here. People probably are going to need a couple of treatments, maybe 2 treatments to get something to kind of resolve. Mild, maybe about 4 treatments over a span of about a month. Moderate, typically could be anywhere from 6 to 8, maybe up to 10 treatments over about a 2-month period of time. More you're getting out to that severe end of the spectrum, it's going to take probably about a dozen treatments there, over about a 3-month period of time. We slowly taper those treatments off. The only case where we generally don't do that is when we're treating our neuropathy patients. They're coming in about twice a week to get treated with shockwave in addition to their laser treatments and PEMF treatments and other treatments that they get done in the office. Then you get out to the extreme end of the spectrum, and that's where, hey, it's I'm just going to say 12 plus, because some people we've had with really extreme problems that they're probably even getting out to about 24 treatments, just because something's been there for a really long time. They're probably getting to that point where they're a candidate maybe for a joint replacement surgery or something like that. And even a lot of those, it's just kind of the touch-ups because they might tweak the joint or something like that because they had a knee or something, or even their lower back, is just a little bit maybe unstable. We need to get some rehab done with it to strengthen it up. But the shockwave therapy will knock it out, and they might be good for a month or 2, and we got to treat it again. So.
Well, that sounds fabulous. What was I going to ask here now? Shockwave. Now, we've mentioned joints versus muscle tissue. Does that feel different? Is there a different type of protocol for the patient? When we're, say, focusing on back, if we're focusing on trigger points versus a disc?
Well, typically people are going to have different pain patterns. I mean, you get into the spine, and a lot of people are going to have probably closer to what are called dermatomal pain patterns, where the nerve is probably being a little bit irritated, where it exits out of the spine. So you're going to see that get mapped out over an area that would be consistent with that nerve being irritated. If it's a bone and joint type of pain, they'll call that a sclerotogenous type of pain. And typically, if we're looking at the spine, it could relate very specifically with the spinal levels that we're dealing with. But some people can have referral pain out to other areas of their body with that. Again, getting out to muscles and soft tissue type things, we're looking at myofascial trigger points, where the area that we might have to treat, they're going to have pain referred out to other areas. An example, like in the spine, it might even refer down the leg, almost like a sciatica kind of distribution, could radiate around even to the abdomen or something like that. So, depending where they have the problem and what's causing it, that even helps us know what has been causing it, so that we can make sure that our treatment is very effective in resolving their condition for them too. So.
Mm-hmm. Oh yeah, it's absolutely interesting when, we're focused the shockwave on a specific area, and a patient's like, oh, wow, I feel that all the way down to my toes. And so it's just, reiterating to the patient again that, we're hitting a good spot. We're hitting that trigger point that's referring outward. And so we're where we need to be.
And I think just one thing, just focus shockwave is called the focus shockwave because of this. I'm going to try and hold this up, see if I'll get it somewhere. Boy, I'm going to have to really figure this thing out here. There we go. Let me get my pen a little bit further away here. Shockwave is going to penetrate about as deep as what my pen is here. And we have different things as far as attachments that we add onto the pen. But typically, the main point of the therapy is about halfway in this pen. So you're going to get therapy on either side of it there, but the main point that we're trying to focus the therapy is right about in the middle here. So if we have to literally work on somebody, I'm just going to try and point this at the camera here. And we might have to angle it a little bit this way. We might have to angle it a little bit the other way there. Sorry for my camera aspects here. I have to go up or down. And that's what's nice about the focus shockwave is that we can literally use it to dial in very specifically onto the area where you're feeling the problem. So with the focus shockwave, typically, you're going to feel some discomfort with it, from a 0 to 10. We're going to probably have you at about a 4 or 5. We don't want it to go any higher than that. We don't want it to be uncomfortable or anything like that. But if you have that pain in that area and it also refers out to the other areas where you have been having pain, then we know that we're getting the area treated. That is the root cause of the problem here so that we can get it resolved for you.
Yes, that's absolutely true. And we've been seeing it very effective with patients. It's safe, non-invasive. Like you mentioned, we do need to see you at about a 4 or 5 out of 10 pain scale, because that, again, lets us know we're in the right spot. When we're getting the treatment diagnosed and dialed into a specific area.
And if the other nice part is if you're really not feeling any pain, that's not an area that we need to get treated. So it's nice to know that we're dialing it in and getting it right in on the area that needs to be treated. So if you're not feeling the pain, the area probably doesn't need to be treated. But if you're all of a sudden starting to feel that pain, then we know that we're hitting the area that needs to be treated and get it resolved to the point where you come in and we can run it over that area and you don't feel anything at all. So.
Absolutely. Well, wonderful, Dr. Bekkum. Any last words here before we move on to the second part of our podcast? So you'll see this in 2 parts coming up now from here on out. The second part will be more on modifiable lifestyle factors that go in with chronic back pain. Any last words before we move on to our next session?
I mean, the thing is, if you think you have, some kind of joint problem that, either you want to have us take a look at, or you've already been recommended that you should be having some kind of procedure done, maybe you should come in and just get a consultation to see if focus shockwave might be something that could help you, maybe even resolve the condition so that you're not having to go on and have some kind of surgery or, use some kind of drug, which does have side effects and all that. There's no known side effects to the focus shockwave here, other than maybe a little bit of local soreness, after we've done it there. Other than that, nothing else. So, if you want to reach out and contact us, we can get you a consultation. You can experience it for yourself to see if this could be something that could even help you, after we've gone through that consultation. So
for round 2, second part of going over chronic back pain with shockwave therapy. So now the second part is going to introduce what we call the modifiable lifestyle factors for back pain relief. So we will start with number 1, sleep and relaxation. So of course we need sleep. Everybody needs sleep. You're not healing if you're not sleeping. But of course we know with back pain, sleep can be restless. There may be things you have to do differently at this point, having better supportive pillows, which at our office we can do specific measurements and get you a pillow that works best for you, whether you're a side sleeper, back sleeper, and try to stay away from the stomach sleeping. Your bed itself, that's one thing that we know is more than likely going to be different for everybody. Some may need a more firm bed, some may need a less firm bed. It's finding what's going to be best for you. And we can always give you recommendations on where to go get a bed. Sleep Number has great options. What's the place just across the road here?
Beds by Design.
Yes, Beds by Design.
Comfort King. There's lots of mattresses out there. Purple Mattress. I mean, everybody's so finicky once you get to pillows and mattresses. I mean, because, sleep is a key thing that helps your body rest and restore. So not only be able to sleep really well, so finding that pillow, finding that bed that's going to give you the best rest. And, really it's probably going to take, if you have some kind of device that can track that, I know I've used an Oura ring myself. That's spelled Oura. If you want to look that up, you can see how that can work. That's really good at tracking your sleep. I think I've found that to be the best out of any kind of tracking device that I've used in the past. But you can also use like an Apple Watch is pretty decent. Um, Again, I like the Oura ring myself a little bit better. It seems to be a little bit more accurate with it. But then you're going to know, hey, did that change in pillow help? Did that change in mattress help? It could be blankets that you put on your bed or sheets you put on your bed. Maybe it's a weighted blanket you put on your bed that helps out. It could be, yes, a sleep number bed, so some of those are self-adjusting, but if they're not, again, just watching your sleep and trying to figure out exactly, do you need it more firm or do you need it less firm, so that you can literally get the bed set exactly where you need it, so you can get a sleep score that's 85 or above on a consistent basis, because that's when you know that you've gotten the proper rest. Some of the devices will track heart rate variability, which is key. You want to see that heart rate variability go up at night, so that you know that you're getting the rest, and your heart is even able to kind of rest and relax as well. So,
and one thing that I have gone over now most recently, and this can be a whole nother topic, but there's looking at toxicity of mattresses and pillows. And some people actually can have a high load of toxicity from memory foam. That was tested in me personally, and I was found to have a high toxicity of memory foam. But again, that can be something we talk about along the way. But yes, to get a better restful sleep, finding the right pillow, finding the right mattress for you. A few other things we noted here, meditation. Yoga breathing can be very helpful, just slowing down that nervous system, calming it down so you can rest more soundly. Some things that I personally have found to be helpful, infrared heating mats, just calming, especially if you have muscle spasms. Because typically with a back pain, yes, you may have had a specific injury, but your muscles are going to do their part to maybe overprotect at times. So you may get some increased muscle spasms due to that as well. But getting your restful sleep during an injury, helping you relax, heal, recoup, and that can be dependent upon the injury too. If it's something simple and small and easy to move forward, or if it's something more long-term where we got to really, really narrow it down and focus on what we got to do to get you better sleep.
Yeah, and kind of getting into the meditation aspect there. I think I mentioned on a previous podcast here too. There's lots of apps out there. I personally use the app Calm. That is a very good one. And they have, meditations or even sleep stories you can listen to of all kinds of sorts some are just literally nature sounds. Some of them are literally stories you can kind of fall asleep to. There's, meditation things you can do at night as well. So, but also during the day, they have tons of different meditation type things. You might be stressed at work or something like that. They have some meditations that you can do for that. Even some teachings from various different people, all of them that are highly skilled, that can give you a better idea of what you can be doing to help mitigate some of the stress, so that you can find some relaxation after you've maybe had a stressful day. So,
and if you have kids like I do, there's an app called Moji. It's very similar to Calm, but it does have sleep stories, so that works pretty great for the kids too. For me, I find reading. If you like to read and enjoy a good book, that'll put me to sleep like that.
Well, probably another thing, if you kind of think of that as well, is some people literally need to do, and I've heard other people mention it, they'll call it like morning pages, but some people really need to do it at night, is to literally just sit down and write down everything that's in your brain, even if you're just like, this is stupid, I don't know why I'm writing this stuff out. But I think that, I got to go get groceries tomorrow. I need to do this. I need to do that. By writing it down, getting it out of your head. And then, typically what they'll have people do is just burn that then. Or, if at night, if you want to save it beside your bedside, look at it in the morning. That way, you've gotten it out of your head. You don't have to think about it anymore. Or if you do need to think about it again, make sure you write it down in a place, or, put it in your device so that you know that you're going to have a reminder for that, so that you're not stressed out, worried about missing out on something like that. So,
Great. So great reminders on sleep and relaxation, especially back pain relief. Moving on here, let's look at exercise and movement. So you've had an injury, you've had a back injury. We may not be exercising to our full extent at this time. We might not be jumping back right into marathons, but movement is still recommended, especially just being a slow and steady progression and working with your professional healthcare providers to get you there. There's going to be different steps in the process, and it's where you're at now to where you need to be, where you want to be, and just focusing on that continued progress. Again, it'll be very dependent upon the injury that has happened, the impact that has occurred to your back or body. But key simple things is we know with any type of back injury, there's probably going to be some core strengthening involved. Now, core strengthening, we always think, oh yeah, we got these abs, right? Well, there's more to it. You got your whole centered core. You got these large back muscles that you see, you look in the mirror. But we tend to forget that there's all these little tiny intricate muscles that are surrounding our spine, and those are your big stabilizers. So anytime you do have a back injury, those get irritated as well, and that's where we tend to see some of those muscle spasms that we talked about earlier. Walking. It's simple. It's something that anybody can do if you're in that right motivation and that right time frame of your care, but that's not only good for your vascular health, but helping just move blood, move oxygen to those body parts that need to heal.
Yeah, get all the nutrients out to the tissues there so that they can heal up. Also making sure that, when you are moving, I usually tell people to try and move, especially if they have an injury going on, up to that point of pain. I mean, you're going to obviously have that achy soreness there, but you don't want to move into that point where it maybe feels like that sharp stabbing pain or it feels like it's aggravating the condition. You want to kind of stop at that point because, even when you're working out, when you're injured, you only really want to work out at probably, and even in most cases, when you're working out, even after, recuperating and recovering and rehabilitating an injury, is you want to work out somewhere between about 50 and 75% of your capacity, unless you're getting ready for a contest somewhere. Then you want to kind of push it and get up to that, 75 to 100%. But you don't want to do that on a regular basis because you're going to burn yourself out. But if you're getting ready for a competition, go ahead and do it. So going back to, an injury here, just work up to the point where you feel like, hey, I can do this here, or maybe do an exercise like walking there that, if you have some neck pain going on, you might be surprised at how just getting out and going walking can slowly start to help just get things moving a little bit better because, yes, you're getting that oxygen out to the tissue, you're getting that nutrients out to the tissue, the hydration even out to the tissue, because you have gotten that blood flow going a little bit better there, and you're probably going to help speed your recovery there. Just because you have a neck pain doesn't mean that you shouldn't be doing any exercises at all, and even any body part at that, at that rate. So make sure that you're not aggravating anything, but make sure that you are doing something here so that you can, continue to improve.
Yes, stay moving. Movement is key to anything in life here.
Because if you're not moving, you're
dead.
Dead. Yeah.
We don't want to see you dead. We're here to prevent those type of scenarios. Nutrition. So, of course, we know eat your veggies, simple, right? Well, there's that. There's having balance. There's making sure your hydration levels are up, just like we talked about previously. Hydration needs to go to those tissues, and the better hydrated you are overall, the better that movement and flow can get to those tissues. We talked about, spastic muscles earlier. There's some nutritional products or supplementation that can be recommended. Magnesium glycinate can definitely help calm those muscles. I was looking up something earlier that I was going to put in here. I thought I got it on, so I misplaced that. But even at night, we can tend to see, you'll get the spastic muscles, but looking at possibly adding a natural calming pain reliever. Simple things as adding turmeric to your diet at that time. Cinnamon is great for that too. So those are also anti-inflammatory. One thing to note with that too is that we always tend to avoid what we call vitamin I, your ibuprofen. Yes, maybe the first 48 to 72 hours is okay, but then after that we start to see that it can hinder some of the healing effects, start blocking some of those endorphins that your body needs to continue progressing to heal. So yes, ibuprofen is maybe necessary for a tidbit, but after that,
I mean,
we
even
kind
if
of
you
look
read
at
the
more
bottle
natural.
if you read the bottle for like ibuprofen, it says you should stop taking it after 2 weeks and seek, medical attention for it, because you're really not meant to take it for any longer than 2 weeks. But unfortunately, some people, yes, have turned it into vitamin I. They just take it on a regular daily basis, and they don't realize what they're really doing to themselves by doing that. I mean, you might be taking care of some short-term inflammation with that, and giving some pain relief, but you're now, because you've done that, you've shunted it. Now you're causing long-term, low-grade inflammation in your body that's going to accumulate over time. And as time goes on, then things like those types of drugs aren't going to work as well with you there, because you actually caused a whole nother biochemical problem. And that's the problem with a lot of pharmaceuticals, is that, yes, they're needed in cases, but all of a sudden, because you've kind of messed with your body's biochemistry, you've now caused other problems. That's why we like to try and stick to things that are going to help heal your body up naturally, by giving your body exactly what it needs to heal itself, like even just a general multivitamin, B complex, to give you that energy there. Essential amino acids are key, especially when you're having soft tissue injuries to muscles or tendons and ligaments, and bones and joints. Even essential fatty acids. I mean, I was reading an article here in National Geographic that they're saying that, omega-3s were maybe way more helpful than what we thought they were. And I've been telling people for, unfortunately, probably 3 decades now, that they should be using fish oils, not only for heart health, but also for pain relief. You also need it for hormone production in your body.
Mm-hmm.
We don't need to go down that whole rabbit hole here right now, but by giving your body exactly what it needs to repair itself, your body's amazing, and it can do just that. So just remove the things that are causing it to not heal up. And that's what we're trying to do when you come in the office here, is to help you deal with some of that stuff, and then even replace some of the things that you maybe aren't getting, whether that be changing your diet so you're eating some foods that are higher in some of those nutrients, like salmon, has some of those oily fish are high in those essential fatty acids that you should be getting in, that are helpful in pain reduction. And they're also high in those essential amino acids that you need as well. So you can get a lot of that just by, changing your diet a bit and eating some healthier choices than maybe what you had been eating before.
Exactly. And if you do have further questions on that, there's things that we are implementing at the office as far as specific testing for nutrients. So stay tuned. That will be more forthcoming as the time goes on here. Stress, right? We talked about this the last video, or the last scenario, but you have back pain. Now you're stressed, even more than maybe you were. Just a quick study in 2020 that they showed that low back pain affected 619 million people globally, and it's only expected to rise. So what can we do, number one, to prevent that from occurring? And then number two, if something does happen or an injury does occur, what we can do to get you back on track as fast as we can do that. But avoiding stressful situations, knowing that, yes, I hurt my back now, but again, we have to look towards the future and get you back to where you were, or even better off, as we work through strengthening, progressing, getting your body rejuvenated overall. What we tend to see when we are stressed is we don't do things as fluid as we used to as well. I know this because I'm a mom of 3 kids, so when I'm stressed, I'm busy and I'm doing all these things, but just calming that system as best you can. Try to tackle things one by one and not overdo it, so that, yes, you may re-injure something or just further slow your progression of healing. So reducing your stress. Simple things noted here: if you're at a job where you sit, having a great postural, supportive chair, lift with your legs, do all those good things that are going to be best for your back to reduce a stressful scenario happening.
And just remember that there's basically kind of three different areas that we look at here. I mean, there's not only just the physical stress, where it might get into ergonomics, where you want to make sure you have a good supportive chair for yourself, so you're supporting your back there. Mental stress, again, maybe your boss is really stressing you out here. And you need to literally find ways of, I wouldn't say coping with it, I would say dealing with it. Try and find some ways that you constructively can work through it. Otherwise, you're going to end up going back. And if you don't deal with it, at some point in time, it's going to blow up and just cause a big problem. And then it's those chemical stresses, like kind of like we talked before with the diet and nutrition there, just making sure that you're using things that, is healthy for your body here. And you're not putting, things into your body that might actually be stressing you a little bit more. Some of the artificial sweeteners, or, look at all the foods that are out there. I mean, if you can't even pronounce what's in the food that you're eating, you probably should not be eating it. You want to eat something as close to its natural state as possible. So.
Exactly. And one way I look at that is, take an apple, for instance. You'd rather eat the apple. Then the next step would be, getting worse down the line would be apple juice, and the worst by far would be apple sauce. So that's just a simple way to look at it, from being most natural in its cause to most unnatural. Let's move on. Our final and last step, or our last modifiable lifestyle factor for back pain.
Is that really ornery boss you have to deal with here, right?
Yes. Relationships. One thing I just would like to speak on here is, you may have an injury now, and those around you may not comprehend that as well too. So if you having pain and maybe, talking about the pain amongst people, sometimes you'll see that they almost become standoffish. And that's just, you have to understand that they might not know what you're feeling, what you're going through, because they're not living it. And let's hope that they don't ever have to live it. But just being more receptive of knowing that everybody is going to be living this differently. And when you talk about an injury, they might not really quite comprehend that. But on that note, let's just make sure that if they're not comprehending it, they're not making it worse for you either. They're not going to be giving you negative feedback, or, we'll tend to see people always give you recommendations. Try this, try that, try this. But, it's always best to work with your healthcare provider. Stick with what being trusting of your healthcare provider at this time. And if something's not changing with whomever you're working with, number one, it might be something on the end of the provider that has to be shifted or changed to make you progress faster. Or at that time, maybe, you might have to look at a different provider or different option of care, whether it's chiropractic, PT. We do see a lot of myofascial release or acupuncturists nowadays. But those are going to be part of your new relationships. So you might build a greater bond with them. And not only is that good for you and your health of mind, but you can also work with them, and, that's a great referral system too. So they're helping you on one end, but you can give back to them too.
Yeah, I mean, there's, again, if you get into the provider aspect of it here, I mean, there's a full spectrum of providers. I mean, there's providers there to help you, especially when you do have that acute type pain. And then there's providers on the other end of the spectrum that are then now helping you, not only, you've gotten through rehabilitation, but also making sure that you can prevent things from happening in the future again. Some things aren't preventable, but a lot of things might be. I mean, if it gets down to the relationship aspect here, it might be, dealing with those stressed relationships, whether that be, a spouse, a significant other, your children, your parents, relatives, friends, whoever that might be. And sometimes it might be, like Victoria said, and even the previous episode here, is like, you might have to literally almost kind of remove those people from your life that just aren't respecting, what you have to say, or don't understand what you have going on, and just kind of move on. It's something where they don't have an idea of really what's going on with you, what's causing the issues that you have going on, and they really have no authority probably to even decide if what you have going on should be causing the issues that you're having. So, sometimes it's those toxic relationships that do need to be removed. And obviously, try and hang on to those ones that are, to be supportive of you. Like, be cautious though, on the other hand too. And, you get into these relationships where you see, bosses or people of different businesses, they have their sycophants where they just sit there and hang and nothing's wrong. The emperor with no clothes. You look great today, and they have no clothes on. There's still something going on. There's obviously something going on. Don't try and cling to the people that are doing that either. You got to find that happy medium, because everything is going to bounce back, both ways. I mean, you might end up having something that really significantly affects you, and then hopefully like Dr. Victoria here too, you can use that for the good of other people. Hey, I know what it was like when I had this. Now, hopefully I can turn around and use that for good to help other people here too. So.
Oh, absolutely. Makes the world go around. If you can have a good experience and present that to somebody else that may be having a similar situation, and benefit them and then benefit the provider, and keep it circular in motion there. Well, wonderful. Any last thoughts, Dr. Bekkum?
Nope. I mean, and again, we might not have touched on everything that a person might have going on that's dealing with, back pain relief here, whether it be acute or chronic. These are just some of the things that are going on. Everybody's different. So if you do come into our office, we do look at things from a bit different perspective, in that we're looking at from a functional medicine perspective, more holistic, and trying to make sure that we're not only dealing with the issue that you have going on, but we're trying to find the root cause so we can get rid of it for you, so that hopefully long term you can live a full and productive life and function at your full potential. So if you do have something like this going on, and you've tried some of these things already here, and you just have been at other providers, or you want to have us take a look at us, just give us a call and set up a consultation. We always have free consultations, so we can just determine if what you have going on is something that we can treat, and if we can, we'll let you know, and we'll let you know what you need to do to move forward from there. So.
Absolutely. So you can find us social media wise. You can find us at allseasonsintegrativehealth.com, and of course call the office 701-356-0016, and then make sure to listen.
It's actually allseasonsintegrative.com, not allseasonsintegrative.com. Not
I
health.
said it all too far.
We had to take that off to try and shorten the website up there. So
I suppose. But podcasts. So follow along with the podcast.
Yep.
These will, of course, be, live video streamed, but these will also be uploaded to the streaming service that you use. Have a good one.
Bye.
Thanks for listening to the Extraordinary Health Podcast. For further information or to set up an appointment, go to the website at www.allseasonsintegrative.com or call us at 701-356-0016.